Do you use CPT in your day-to-day coding activities? And do you code in the 30,000 series of code? Hello, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder.
Today, let's look at the CPT 2018 updates for the cardiovascular system, starting with the heart and pericardium. In support of the changes in reporting endovascular repair of abdominal aorta and or iliac arteries procedures, the guidelines in the fenestrated endovascular repair of the visceral and infrarenal aorta section have been revised by replacing deleted codes 34825 and 34826 with new codes 34709, 34710, and 34711, and by making the language consistent with the language in the new endovascular repair of abdominal aorta and or iliac arteries guidelines. The exclusionary parenthetical notes that follow codes 34841 through 34844 and 34845 through 34848 have been revised to reflect the appropriate new codes. The cross-reference parenthetical note for placement of distal extension prosthesis terminating in the internal iliac, external iliac, or common femoral artery that follows code 34848 has been revised with the appropriate new codes. In support of the changes in reporting the endovascular repair of abdominal aorta and or iliac arteries procedures code 34900 and its associated guidelines and parenthetical notes have been deleted. An instructional parenthetical note has been added directing users to code 34707 and 34708, which describe repair in the iliac artery with an ilio-iliac tube endograph. In support of the changes in reporting endovascular repair of abdominal aorta and or iliac arteries procedures, cross-reference parenthetical notes in the direct repair of aneurysm or excision, partial or total, and graft insertion for aneurysm, pseudoaneurysm, ruptured aneurysm, and associated occlusive disease section that directs users to deleted codes 34800 through 34826 and 34900 have been deleted and replaced with a new parenthetical note that directs users to the new endovascular repair of abdominal aorta and or iliac arteries codes. The exclusionary parenthetical note that follows codes 35403 have been revised to delete code 35500, and the phrase when performed in the same vessel has been added. The same revision has been made to the parenthetical note that follows code 35306. The other procedures listed in the exclusionary parenthetical note may be reported when the procedure is performed in a different vessel, per the phrase that has been added to clarify the intended use for these codes. In support of the deletion of code 75658, code 36120, which is used to report the retrograde introduction of a needle or intracatheter into the brachial artery, has been deleted because this service is more appropriately reported with other existing upper extremity angiography codes. As a result, code 36140 has been revised to specify upper or lower extremity artery. In addition, code 36140 has been reformatted as a standalone and non-parent code. An exclusionary parenthetical note after code 36456 has been added. The parenthetical note provides instructions prohibiting the use of modifier 63 in conjunction with code 36456. This is consistent with other transfusion codes for patients younger than 2 years that include instruction that restricts the use of modifier 63 in conjunction with those codes. 4 codes 36465, 36466, 36482, and 36483 have been added for reporting newer treatments of incompetent veins, and 3 codes 36468, 36470, and 36471 have been revised. Parenthetical notes and guidelines have been added, and existing parenthetical notes and guidelines have been revised to provide clear instructions on the appropriate reporting of the new and revised codes. Prior to 2018, there were codes to report some methods of treatment for incompetent veins, specifically direct puncture sclerotherapy, mechanochemical endovenous ablation, laser ablation, radiofrequency ablation, ligation and stripping, and stab phlebectomy. For 2018, codes 36482, 36483, 36465, and 36466 have been added to describe newer treatments that involve the use of chemical adhesive and non-compounded foam sclerosant. Prior to 2018, these treatments were reported with code 37799, the unlisted procedure vascular surgery. Codes 36482 and 36483 describe endovenous ablation therapy using a chemical adhesive. In this procedure, the catheter is tunneled through the full length of the incompetent vein, and the adhesive is administered remotely from the access site to ablate the length of the incompetent vein, as opposed to being administered under the skin using a needle or mini catheter. Code 36482 is reported for the first vein treated. Code 36483 is an add-on code and should be reported in conjunction with code 36482 for subsequent veins that are treated in a single extremity through separate access sites. Code 36483 is reported only once per extremity, regardless of the number of subsequent veins treated. This is noted by the optional plural, i.e., adding the plural form of a word in parentheses, and in this case, the parentheses around the S in veins. Codes 36465 and 36466 describe injections of a non-compounded foam sclerosant into an extremity truncal vein. The sclerosant described in these codes is not compounded by a physician or other qualified health care professional. Hence, the term non-compounded is specified in the code descriptor. Compounding is the process of combining, mixing, or altering the ingredients of a drug by a physician or other qualified healthcare professional to tailor it to an individual's patient's needs. When a compound sclerosant foam is injected for treatment of an incompetent extremity truncal vein, codes 36470 and 36471 should be reported. A definition of compounding has been included in the new guidelines to help users determine if a compounded or non-compounded sclerosant was used in the procedure. Codes 36465 and 36466 include ultrasound compression maneuvers. These compression maneuvers are performed under ultrasound guidance to control the dispersion of the foam sclerosant and to ensure that the sclerosant reaches the intended treatment area. The ultrasound guidance and monitoring are included in codes 36465 and 36466 and should not be reported separately. Prior to 2018, the descriptor of codes 36468 stated single or multiple injections, which left room for interpretation regarding the number of times the code could be reported if multiple injections were performed. For 2018, the CPT language convention of optional plural, i.e., adding the plural form of a word in parentheses, and in this case, the parentheses surrounding the S in injections, to clarify that the code 36468 is reported once per limb or trunk, regardless of the number of injections performed. The unit of service for code 36468 is the limb or trunk, not the number of injections. Guidelines and parenthetical notes have been added to clarify this. Codes 36470 and 36471 have been revised to specify the type of veins treated. Prior to 2018, these codes only described injection of sclerosing solution of a single vein or multiple veins without specifying the condition of the vein. This lack of specificity made it unclear that the codes did not include the treatment of spider veins, which made it difficult to distinguish them from Code 36468, which specifies treatment of spider veins. For 2018, Codes 36470 and 36471 have been revised to clarify that they describe procedures performed on incompetent veins other than spider veins in order to make it easier to distinguish these codes from Code 36468. Several clarifications on the appropriate reporting of treatment of incompetent vein codes have been made to the guidelines and parenthetical notes and should be reviewed carefully. Also, in accordance with the deletion of codes 29582 and 29583, the parenthetical note that follows codes 36479 has been updated to reflect these deletions.
Are you interested in the field of medical coding? Well, we offer an online medical coding course just for you. Click the link in the description box below for details on our online medical coding courses. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.